workers who have fought through this for so many months, who will continue to fight through this for so many months. This is a very important day. This is a hopeful day. It's very important that when the vaccine comes, that we feel confident in the science that is okay to take. I wanted to be here. I was excited to be here to tell, for my family, for my patients, for the community at large, for the world at large. It's a very important day today, a very hopeful day. We have to continue, however, on this journey to remain safe. Yes. Wash our hands. This is going to be very important, not to gather. If we do all of those things successfully, we will conquer this virus. So I thank you for this opportunity.
Doctor, you've seen so much trauma and so much death over the last 9 months. What was going through your mind when you felt that injection?
Hope. We've been through so much that this was the first step towards hope, towards getting to a place where we do not have to worry about ourselves, about our loved ones, about our families. We've seen a lot of despair, and this is a positive moment. This is a major turn, the most significant turn during this pandemic.
Doctor,
what is your message to people who are still skeptical about this?
There is science behind the vaccination. There is a lot of science that I've researched, our colleagues have researched, the FDA has researched, New York State has done its independent research on the vaccination. It is safe. I had no fear, no doubt of sitting here and receiving the vaccination.
Doctor, over here, please. You know that a lot of communities of color have been hard hit by COVID, and some were fearful of getting the vaccine. Is it important for you to reassure them that the science is there to get this and to feel good about it?
Absolutely. And for those who have suffered the most, the consequences are the greatest, and the reason to take the vaccination is even more significant. So I encourage you to read the science, to listen to the recommendations of the scientists and the physicians. I recommend it. I am from that background. I am from that community, and I saw a lot of devastation. I saw it personally in my family. So it is very important to not fear the vaccination. It is based on science, and this is what's going to save the lives. We cannot continue to have 3,000 people die a day. This has to stop, and the only way to stop this is through the vaccination.
Can you talk about your own family? You mentioned your own family.
Yes, unfortunately, I had someone in my family who I've lost dearly, a dear uncle, and I have someone right now currently in the hospital, a family member. So this continues, and the way to stop this is through the vaccination. Again, I cannot reinforce how important the vaccination is going to be when it becomes available and how safe it is. But for now, we must continue to take all the measures that we've been taking. We have to resist the temptations to gather. The holidays are very important, it's understood. But the COVID virus is very serious and can spread very quickly when we gather, when we don't social distance, when we don't wear a mask. So we have to hang in there. We have to be resilient. Today is a major, significant day of hope. And this is what's going to carry us through.
Doctor, what is your staff saying about the vaccine? How are they feeling today?
My staff is feeling equally hopeful. They also are ready to take the vaccination. As you know, we're going to start with the frontline workers. They will be the first. And then we're going to go to high-risk, vulnerable people. And so everyone's feeling great. Everyone